The three things that really distinguish, the HELPcare Clinic experience are: first, you're a member, not a number. With a smaller panel size, the members actually have a relationship with their practitioner. Because of the ownership, we're going to expect that there's going to be longer duration of service, because they're becoming a part owner of their practice eventually, instead of just being an employee. The second thing is, it really is that affordable, unhurried care. You don't have the practitioner with his or her hand on the door on the door handle the minute you get in there. It really is that relaxed time and opportunity to get to know your practitioner and have them get to know you. And then finally, that's about helping you take charge of your health.
Well, welcome everybody. This is Dan Hinmon, and I'm the co-host of the Take Charge with HELPcare podcast, and I'm thrilled to have today with us on the podcast Aase, who is the host. And this is a special edition because we have some very exciting news to share with you. It's been a big week, Lee, so tell us what's going on with HELPcare.
Yeah, it sure has. I mean, ordinarily we have a guest that you and I interview, but this time we have enough going on this self that I guess I'm going to be the guest. I'm going to be the subject expert, so to speak.
Great.
We're super excited that last Friday we were able to announce that we're opening HELPcare Clinic Albert Lea, the third HELPcare clinic, early in 2026. You're not from around here, Dan. Albert Lea, Minnesota is about 20 miles west of Austin, where we started our original clinic in February of 2022. And it was just something we've been kind of working toward for quite some time. For at least 2-3 years, we've been thinking about it. And it all kind of just came together in about the last month with some pretty amazing providences, I would say. Some people would call them coincidences. I consider them really a blessing for how this has all worked out in a way that personally I couldn't have orchestrated myself, because I tried to orchestrate it and it didn't work. And so this is just kind of amazing how it's come together.
Yeah. So tell us what's happening. Where is the clinic and what's the timeline, and give us some of those details.
Yeah, well, so just around the first part of October, we began having conversations with the owners of Skyline Mall. Actually, Skyline Plaza is what it's called now, and it's on the west side of Albert Lea. The space that we're looking to occupy, in fact, we've signed the lease to occupy, used to be the VA outpatient clinic for Albert Lea. The VA clinic was there for a little over 5 years, I think 5 or 6 years. And then they built a new facility just elsewhere in Albert Lea and vacated it. And it really has been empty since that time. And a portion of it was rented to a Seventh-day Adventist church, which is going to be a really good neighbor for us there. But there's a whole bunch of it that still has the sinks, and you can see the stain on the floor where the exam tables used to be. I mean, so it's really ideally set up for an outpatient clinic, for a primary care clinic. And so it was really exciting to find this space. Meanwhile, we found also a couple of nurse practitioners who are interested in joining with us, and between the two of them, we'll be able to cover 5 days a week. And then we have some additional staff. Some of our current staff will probably be spending some time over there as well from the Austin clinic. So the fact that this all came together, the landlord has been wonderful to work with, is very excited and eager to make this work. And so he's had some good flexibility for us there as well. So just the fact that, I think the negotiations took about an hour for the lease. It was really very, very quick to get done. So yeah, kind of what one might even call miraculous.
It's a beautiful story of how that can come together when all things are for good, right?
Absolutely, yeah.
So tell us about when you think you'll start accepting patients at the new clinic.
Well, we're planning on an event, a HELPcare Community Kickoff, that's going to be November 20th, and it's at Wedgewood Cove Golf Club in Albert Lea. It's going to be that evening, starting at 6:30. It's going to be a free event. We're also going to, in cooperation with the Free Market Medical Association, of which I am the Minnesota co-leader. We're going to be doing a documentary screening of the film that we've talked about a little bit previously, where Chris Deacon is one of the stars, who was one of our guests in an earlier episode of this podcast. But the film, the documentary is called It's Not Personal, It's Just Healthcare. And it really lays out the problems with the U.S. healthcare system and how all the incentives are set up in the wrong way to make things cost more and be more frustrating for both patients and practitioners. So we're going to have that as make kind of the filling of the event. And at the beginning of the event, we're going to have introduce our practitioners, also introduce some of our current members, have them share some of their stories. And then afterwards, this is my long way of answering your question, we'll be announcing the opening date for HELPcare Clinic Albert Lea. So we want people to come to the event to find out about it, and they'll also find out about a special early bird membership option that we're going to be offering for people who join before we open the doors, before we start seeing patients. We'll have some opportunity for savings on our membership. I think it's going to be a great, very memorable event. We've got a few dozen people already signed up just in the last couple of days to join. So we're expecting a good turnout. It is a free event, and with the movie showing, we're going to have popcorn and movie snacks, that are going to be provided as well. We think it's going to be a really great, community celebration kind of time, that there's a new option for primary care in Albert Lea.
And how do people sign up for the...
Right. They can just go to our website at helpcare.health, and the tickets are on Eventbrite, but the links are there. We'll also have links on Facebook and other places like that. So if they go to helpcare.health and then in the locations menu, choose the Albert Lea dropdown, or go to some of the latest blog posts, there are places where they can reserve their tickets.
Great. We understand. Well, we know that we already have patients in Albert Lea, right?
Right. Yeah. There's almost 70 patients for HELPcare Clinic, members of HELPcare Clinic, who live in Albert Lea. And then, probably twice that many who live closer to Albert Lea than to Austin. And so we think there's already a really good nucleus there, including some, with the Moore County Health Plan, there are county employees who live in Albert Lea, and it's been a little less convenient for them to get their care at the clinic we have in Austin. Now we're coming to them. And so I think it's going to be an exciting thing.
Yeah, really good for them. So what is the reason to go to Albert Lea? Had you thought about expanding HELPcare? You must have had other options. Why Albert Lea?
Well, Albert Lea's kind of our sister city in Austin. Some would say rivals, but we're really just friends. They're good neighbors. They've had a lot of frustration over the last several years with the healthcare system, as the hospital that they have there was, they would say closed, but kind of consolidated with what Mayo Clinic has in Austin. They're kind of put together as one. And so some of the services that previously been offered in Albert Lea are now only offered in Austin. Some of them got moved to Waseca just recently. And so essentially they have an emergency department, in Albert Lea with the hospital there. And they do some primary care there, but the level of concern in the community at the closing of the hospital was evident in the fact that they put together a coalition of local activists who raised a bunch of money and encouraged the Mercy One out of North Iowa to come in as an alternative. But then when we really started to get kind of seriously thinking about this was in August of 2023, Mercy One announced that they were pulling out of Minnesota, pulling out of Albert Lea. And so at that time, there were about 5,000 people who had already switched their primary care over to Mercy One. And at that time, I had some talk with some local folks and said, I think we could be part of your solution. We're not your whole solution. We're not a hospital, but we could be part of the solution. Meanwhile, we were still very much in the growing phase in Austin and had started in Rochester. So the time wasn't quite ripe yet. But then earlier this year, we started to renew some of the conversations, started exploring a little bit more. And it's a really long story that it's for the full length feature film. It's not for the podcast like this. We can't go into all of it. But it just really took off and really came together really in the last 4 to 5 weeks. And so it was really exciting to get to the point where we were able to, announce that we're going to actually make it happen. I guess one other thing that I'd add is that Mayo Express Care, which was in the Hy-Vee grocery store has been closed as well. So that's just in the last few months. They closed both in Austin and Albert Lea. And as I understand it, a big part of it is the difficulty in staffing. That it's difficult to find nurse practitioners who were willing and wanted to work there. And so I think that's where it's really exciting for us, is that we have 2 new nurse practitioners who do want to work with us, and they think this is a different way of doing healthcare that they're really interested in doing, eager to do. But again, the closing of the Mayo Express Care just means that there's that much more need for primary care alternatives and for acute care alternatives, because otherwise you're just going to the emergency department. As we all know, that's the most expensive way to get your healthcare. So anyway, it's all kind of coming together in a pretty neat way.
Well, it's so good that HELPcare can step in and help solve this need for additional primary care there in that community. So let's take a minute and talk about a little bit about the direct patient model for those who aren't familiar, who are listening to this podcast maybe for one of the first times, and how that can really benefit those folks in Albert Lea.
Sure. Direct primary care means that it's direct between the patient and the practitioner, the provider. So it's not going through the insurance company to get paid. It's paying directly. And the basic model is a membership. So instead of just the ordinary fee-for-service kind of approach, and where the insurance companies come in and take a big slice of that, of those premium dollars, and that doesn't get to the practitioner, and it inflates the cost for the patient. Having a membership model reduces the administrative overhead. We don't have to have 3 people like me fighting with the insurance companies to get paid. And so we can provide care in a much more cost-effective way, much less hurried. I think one of the things that people get frustrated with is if they have a 15-minute office visit, it may end up being 10 minutes that they actually get seen. And that's frustrating both for the patients and for the practitioners. The practitioners are seeing, 20 patients a day, perhaps, and that just feels like a treadmill for them, and they don't really have time to have a conversation with the patient and really understand what's going on, underneath the hood, so to speak, and what are the challenges they're facing. So they really don't have any alternative other than to prescribe a medication for high blood pressure or for high blood sugar or for whatever other condition, because if you only have 10 or 15 minutes, that's really all you have time to do. Where the model that we have, instead of the 15-minute visits, our first visit is an hour. And that during that time, the member, because he's a member, that's, I guess, one of our distinguishing characteristics. We say you're a member, not a number. And so instead of a couple thousand patients on the panel, our practitioners are limited to 600. And that just means that you have more time to really build a relationship, get to know your practitioner gets to know you. And it means that when you have that first hour to talk about all the things that are going on, then we can order lab tests that can, diagnose or confirm some of those issues, but also then developing a plan together where the patient, the member, really is in charge. Thus our title of our podcast, Take Charge with HELPcare. Patients in charge, members in charge, and because it's his or her health, and we want to give them the resources and tools to be able to, perhaps through lifestyle, they can solve a lot of the underlying causes of the symptoms that they've been having, instead of just masking with prescriptions.
So they get unlimited primary care for a flat monthly fee. They get the advantage of several labs included in that as well for them. And then these visits are 30 to 60 minutes each time that they get with a provider. I think you've said before, the number of appointments a provider typically sees in a day is what, 8 or 9?
7. The cap is 7. Yeah, it would
All
be
right.
an extremely unusual time that would be more than 7. Maybe cold and flu season or something like that, where you need to just use an extra one or something like that. But no, we build in time in the schedule so that if somebody's sick today, we want to be able to see him today.
Mm-hmm.
But then also, to provide that timely care, but then also planning out, over the longer term, being able to have those onboarding appointments, we call them, where you're establishing care, where you're building that start of that relationship. And then typically what will happen is that we'll run a series of lab tests that there's about a dozen of them that would be $1,200 or so, perhaps in the in the regular healthcare insurance-based system. But for our basic members and for our premier members, those labs are just included at no extra charge, including any others that, after that visit, the doctor or practitioner may have seen, oh, I think we should check for this, or I think we should check for that. There's about 100 lab tests altogether that are included at no extra charge. Now, the difference between the basic membership and the premier membership is that the basic membership is for people who are really basically very healthy, and they're just looking for the annual checkup plus the acute care, the annual physical plus the acute care, just to spot anything that might be happening. Unfortunately, the way our world is right now, most people are in the space where premier is what they really need, because that means follow-up visits, lab tests that again, still no charge for those. So what we want to do is remove all the negative incentives that people have against getting care. Because in the way most people are with their health insurance, they've got a deductible that might be $3,000, $4,000, $5,000, $7,500. They just never go to the doctor because it's going to be all out of pocket anyway. And so with our membership approach, people can have a defined amount that they know that they aren't going to be surprised by a bill. They can get the care they need when they need it, and then actually really get care instead of spending thousands of dollars for their insurance only to just avoid it because actually getting the care is going to be too expensive. Now, one thing I would highlight that I don't think we've talked about yet is that we've just recently announced a third type of membership called HELPcare Access, which is what I would call, I hope I'm not violating any trademarks or anything, it's kind of like a Costco membership. It's where you get a chance to, for $19 a month, for those who aren't quite sure yet whether they want to, go whole hog with what we're doing, they say, well, I'd like to try it anyway. And so they can, for $19 a month, and then there's a $49 activation fee, they can purchase lab tests and office visits just on an a la carte basis. And this gives them a chance to try us before they decide whether this is something that they want to do as their main way of getting primary care. And so there's no commitment. There's no long-term commitment with that. And still, the prices of our lab tests and office visits are typically 50 to 70% lower than what they would pay in the insurance-based system. It's all the magic of the patient paying directly instead of going through an insurance company who takes out a big chunk for administration and all.
Yeah. That's nice. That's a great opportunity for someone like you say who wants to test it out, see how it works for them, see how the costs really are at those lower prices. And so that's really great. So you have the family or personal membership, you've got small business memberships, corporate memberships. I understand we already have a new corporate client in Albert Lea.
We do, yeah. So the very first corporate client is going to be New Richland Care Center, which is a nursing home. It's actually my wife's hometown. It's about 16, 17 miles northwest of Albert Lea. And we're looking forward to having them be the first of our corporate members. So these are members who employer purchases a membership. And of course, then we're able to give a discount on that because we're not collecting from 20 different people. We're just collecting from the one employer. And, we really want to encourage that. And so it's a good cooperative kind of effort to enable us to get more members and to start to create that nucleus beyond the ones, as I mentioned earlier, who've been already driving 20 miles to Austin to get care. Having this other group joining is really exciting.
So then, Lee, what else do we want to say about this new clinic in Albert Lea? Anything else we need to let our listeners know?
Three things that really distinguish, the HELPcare Clinic experience are: first, I mentioned earlier, you're a member, not a number. With a smaller panel size, members actually have a relationship with their practitioner. Because of the ownership, we're going to expect that there's going to be a longer duration of service because they're becoming a part owner of their practice eventually instead of just being an employee. The second thing is it really is that affordable, unhurried care, that it's you don't have the practitioner with his or her hand on the door on the door handle the minute you get in there. It really is that relaxed time and opportunity to get to know your practitioner and have them get to know you. And then finally, that's about helping you take charge of your health. The way I like to describe it is that our practitioners are the Obi-Wan and the patients are Luke Skywalker. So they're the heroes in the story. It's their story. Our practitioners and nurses and other staff are just the guides, our health coaches. They're there to provide support for the patient, for the member who's really the hero of the story. And so this is, HELPcare Clinic membership is for people. It's especially for people who want to be in charge of their own health and not just subject to whatever the algorithm says they should have, and are interested in diving deeper. Now, with that said, we don't push it on people. If there are people who, through their employer, have a membership with us and they would rather go with a more traditional approach, we can do that too, and we do. But in that case, they're taking charge there too. They're saying, this is I'm satisfied with this kind of approach, and I just really like not having to pay for my care. So that's really what it's all about.
We have some fantastic patient testimonials on these podcast episodes. If people want to go back and hear how our patients feel about the experience they're having with HELPcare, they're really exciting to listen to. So
yeah, well, that was one of the things that was super rewarding for us. And my daughter Rachel, who's our integrator, was saying she kind of felt like a proud mom when the Albert Lea Tribune published the link to its story about HELPcare Clinic opening. And there were a bunch of enthusiastic, responses. And then there were some naysayers or people kind of wondering, well, what do you mean I can't use my insurance, or what's this? And our current members were chiming in with their explanations of why they appreciate it and so that was really, really rewarding to have the people who've already experienced the HELPcare Clinic difference are telling their neighbors and friends about it.
Well, this is great news for Albert Lea, right? They're going to have a wonderful option. They can choose it or not, like we've already said, but it's there. And the people we know who have been using it are just thrilled with it. So why don't we remind our listeners one more time about your kickoff event?
Yeah, we'd really encourage people to come out and to our HELPcare Community Kickoff, which will be November 20th at 6:30 p.m. at Wedgewood Cove Golf Club in Albert Lea. So we're going to start with about a half hour of testimonials and hearing from the practitioners who are working with us. Then we'll show the documentary. It's not personal, it's just healthcare. And then afterwards, we'll have details on when HELPcare Clinic will be opening in Albert Lea, and also on a special opportunity for savings that we'll have through our early bird program. And we'll have all those details will be announced that night. We'd encourage people who are HELPcare Clinic members to come on out and bring a friend. And for people who don't have a friend who's a member yet, just go to our website and get a ticket yourself. And they are free, but we do have reservations required just so we can plan for who's going to be there. But we really look forward to getting to have people get a chance to get a better sense of what HELPcare Clinic membership is all about when they come to the HELPcare Community Kickoff.
Thanks, Lee. It's all good news.
All right. Thanks, Dan. Glad to be able to share this. Thanks for joining us. If you enjoyed this episode, be sure to leave a comment or a review and to subscribe on Spotify, Apple Podcasts, or on YouTube. And also to share Take Charge with HELPcare with your friends and on your social media channels. At HELPcare, our passion is helping people take charge of their health and their health care, helping employers take charge of their health plan expenses, and helping physicians and other practitioners take charge of their healthcare careers. Learn more about the HELPcare Clinic difference at helpcare.health.